Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but were too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. This is episode number 537. Thank you so much for joining me. I really appreciate it. Before we get started, let me remind you, if you'd like to follow me on Twitter, it's at Dr. Kvitko, and if you would please go to my office Facebook page and like us, that would be awesome. Also, all past episodes, complete with video, are available at thereasonswesmile.com. And if you are a dentist with at least 3 years of experience, I'm looking for an associate. So please call me at 614-262-9588 or send me an email at bkvitko@aol.com. All right? I want to remind you that in about 10 minutes, we're going to be giving away free flowers from DeSantis Florist. I'm going to give you the phone number now. It's not time to call yet, but let me just give you that number so you can pre-program it into your phone, 614-459-9769. That's 614-459-9769. So go ahead and get that pre-programmed. Just don't push send yet. And you're going to have a chance to win free flowers. All right, today's show is we're going to bring you kind of an update on the controversial thing called the dental therapist model. The dental therapist model. We've talked about it on the show before, but I just wanted to revisit it because I believe we have some new information. For those of you that don't know what the heck I'm talking about, let me explain. In the U.S., we have an issue where, at least the feeling is that there is an access to dental care issue, especially in these rural areas, meaning there aren't enough dentists in those areas to serve the people in need. So in response to that, somebody came up with an idea. Actually, the Pew Research Institute keeps pushing this idea, and I believe the Kellogg Institute as well, of training people to be able to do drilling and extractions, drilling on teeth and extracting teeth after having about 9 months worth of training, and not having to do it inside a dental office under the supervision of a dentist, but rather they could be within 100 miles of a dental office, and that dentist would be responsible for what that dental therapist would do. Okay? So remember, they would be doing drilling on teeth and extracting teeth. They wouldn't be doing root canals, wouldn't be doing or replacing implants, wouldn't be doing crowns, the best I can tell, or bridges. I'm not really sure. So here's a list of what they would do. They would be checking the teeth of children and adolescents that may need to be treated for dental disease, providing a basic dental treatment for children, which can include cleaning teeth, x-rays, fillings for teeth that may have cavities, fissure sealants, which can prevent cavities, extraction of baby teeth by local anesthetic, and generally education for children about teeth, health, and care. Referring dental issues that are not handled by dental therapists, such as orthodontics, to a dentist, educating and encouraging healthy teeth care habits to children in the clinic and classroom, recommending healthy food choices to parents and children so they can look after their oral health, filing and recording information about children's teeth. Okay, so that pretty much describes what they do. Now, Alaska, Minnesota, Maine, and Vermont are the 4 states that are advocating dental therapists in their communities. Currently, the Arizona legislature is considering introducing the model into their state as well. And so that prompted a letter. Dr. Robert S. Rhoda, a Scottsdale, Arizona endodontist, who is also president of the Arizona Dental Association. And I'd like to read this letter to you. So here we go. And by the way, it's an opinion letter. In fact, it's entitled, My View. States failed dental therapy experiment. And this was in the ADA News, April 16th of 2018, okay? And I agree with it. So it starts. Earlier this decade, Minnesota lawmakers were convinced they had the solution for rural and low-income people not obtaining oral health care. It was to create a new mid-level provider called a dental therapist, and all would be right in the world. What has happened instead should be a cautionary tale for Arizona, where an East Coast foundation is peddling the same off-target solution. While the Pew Foundation and its allies declare Minnesota's dental therapist experiment a spectacular fireworks show, according to Dr. Rhoda, it's really nothing more than a few people standing around waving sparklers. Since that vote 7 years ago, the percentage of Minnesota's Medicaid children receiving any dental service has stubbornly remained around 41%. Adding almost 80 dental therapists didn't budge the rate at all, nor did it reduce dental costs. And now the federal government has put the state on notice. It is at risk of having federal Medicaid money withheld. In contrast, 49% of Arizona kids on Arizona Healthcare Cost Containment System, which is the state's Medicaid agency, had a dental visit last year, about the national average. That's still not high enough, but increasing the rate comes from understanding why kids aren't getting oral health care. It's not because of lack of providers. We need real solutions that address real issues. So here he's saying there are enough dentists to go around. It's not that. Then he goes on to write that Minnesota shows us why. After 7 years of expecting dental therapists to fix the problem, Minnesota's elected officials are scrambling to get more children into dental chairs. Nowhere to be found is any suggestion to add more dental therapists. Instead, the governor asks for a substantial increase in Medicaid dental reimbursement rates, which are so low that dentists won't sign up. Legislators, having been assured dental therapists were the panacea, saw no need to raise those rates. I've been saying all along that access to care is not really access to care, it's access to money. So if you provide enough money, even at a discounted rate, for a dental office to survive while taking care of disadvantaged children and disadvantaged individuals, then they will do it. We would love to do it. I do it myself. We do a lot of donated dental care. We do a lot of work for people that can't afford full price. But you have to have enough to pay the bills. Because if I don't pay my bills, my bank's going to shut me down, right? There's just no getting around that. I have to pay full price for my electric bill, full price for my gas bill, full price for my dental supplies, full price for my employees, you name it. Everything that I do, everything that dentists do to provide the care that we do, we don't get discounts. In fact, I would argue that we're charged extra in a lot of cases because it's, quote, medical. All right, so back to Dr. Rhoda's letter. He wrote, when he says that, he means in Minnesota, they're just now realizing that this was never a workforce problem. Minnesota has plenty of dentists. The legislature there wasted time and energy creating a new kind of professional while ignoring the real barriers to access. Just as in Minnesota, Arizona does not face a workforce shortage. Indeed, 90% of publicly insured children live within 15 minutes of a dentist who accepts state Medicaid payments. Higher reimbursement rates would help attract more Arizona dentists, but the bigger challenge is that Arizona's Medicaid system limits the number of dentists who can sign up. Why is that? I mean, I wonder what could the reason be for limiting the number of dentists? I have no clue. Unless, well, now that I think about it, maybe I do. Maybe it's to make sure that those who do can do enough of it to make a living because they're paying so little per patient or per filling, if you will, then they have to allow those offices to do just a ton of people in order to make ends meet or something. That's the only thing I can think of. But otherwise, it sounds ridiculous. It just does. Okay. So, as it turns out, Dr. Rhoda personally knows of dentists who would accept state Medicaid patients but have been turned down by the state's contracted insurance plans. Adding dental therapists doesn't fix that bottleneck. Allowing any willing dentist into the program would increase access for children, and there's more we should be doing, like focusing on the real challenges that parents face in getting their kids to a dental office. We should continue to be creative in expanding preventive services to avoid tooth decay in the first place. We can effectively do this with our existing dental team and the solutions dentists advocated and legislators approved. Dr. Rhoda went on to write that dental therapists are a distraction. They solve nothing. Legislative efforts to bring this position to Arizona divert attention from the real issues and real solutions. They set us up to be the next Minnesota, scrambling a few years from now after we learn that Pugh's hollow promises only delayed the day of reckoning. So Dr. Rhoda finishes by saying, let's not go there. Let's work together on solutions that will really make a difference. All right, now this editorial was first written in the Arizona Capital Times on March 29th. And as I mentioned, Dr. Rhoda is an endodontist. He is the president of the Arizona Dental Association. All right. And some people would automatically say, because this gentleman, Dr. Rodas, is a dentist, I'm sorry, Rhoda, not Rodas, is a dentist, well then, he's just protecting his turf. And I'll tell you what, it's so hard. You almost have to be a dentist to understand what the heck we're talking about, because, well, here's an example. Okay, so a dental therapist is trained to drill teeth, right? Place fillings. But guess what? A lot of teeth look on the x-ray like all they're going to need is a filling. And then once you get in there, you take away the outer shell where it's most decayed and with a drill or some kind of a rotary device. Then we take these spoon excavators and we clean out the decay. That is soft, and that's how we know it's decay. If it scrapes away, it's soft. If it comes off, it was decayed, because enamel and dentin are stronger than steel, at least when it comes to scraping across it. But a lot of times the x-ray doesn't really show you that the decay is so deep, it actually goes into the nerve. This then means this tooth needs a root canal, okay? So dental therapists aren't trained to do root canals. So what happens then? Well, sounds to me like they would have to extract the tooth. And there's a tooth that could be saved perfectly fine, other than needing that root canal, could be saved. And in this model, it's going to be extracted, when if the person was being seen by a dentist, at the same visit, a dentist could do a root canal real quick, could then place the filling, and all's well. Okay? Now the other thing is extractions. See, a lot of general dentists don't even do extractions. Many of them used to, or were taught how to do them in dental school, but they can be tricky as well. Sometimes a tooth root breaks. You have teeth that have crooked roots. Sometimes the bone is very, very firm, and so they're hard to get out. There wasn't a female oral surgeon in this country, I think, until the 1990s. And so in some cases, it takes a lot of brute force to get a tooth out. And you have to do it in a way that doesn't break the bone, or doesn't leave a root behind, or doesn't damage the next tooth, or doesn't pull off the crown that you might be on the tooth next to it, that if you put too much pressure or leverage using that tooth to get the rotten one out, you can pull off the crown. And there are a lot of things, it's like almost like a little minefield when you do extractions. And so if most dentists don't do extractions, what makes us think that a dental therapist who has like 9 months worth of training is going to be trained well enough to be able to do extractions at the level that they need to be done, so that we're not leaving, or they're not leaving, root tips behind, or cysts that weren't cleaned out properly? Who knows? I mean, it's just an amazing thing. When I talk to other dentists and I show them the kind of teeth I extract, they look at me like, wow, I wouldn't do that one. I used to do them, but I just ran into too many problems with teeth breaking, roots breaking off, and it would ruin their schedule trying to get everything cleaned up and still go back to doing the regular work, the fillings and the cleanings and the crowns and the bridges and the partials. So, while Dr. Rhoda is a dentist, and it's easy to say, oh, he's just protecting his turf, I'm a dentist, and I understand that it's going to sound like I'm protecting my turf, but I can promise you what I'm really protecting, and I think what Dr. Rhoda is protecting, are the patients. The patients, you. I want to talk more about this and some solutions that I have and that other folks have proposed to the problem. But I think it's probably time for us to do Dr. Kvitko's question of the day. As I mentioned at the beginning of this show, the winner is going to receive free flowers from DeSantis Florist. Don't call yet, but if you would like to pre-program the phone number into your phone, it's 614-459-9769, 614-459-9769. Before we do the contest, though, we would like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's Question of the Day.
And the question of the day is, today we are talking about dental therapists. Which of the following is true about dental therapists and what we have discussed on this show so far today? A, the Pew Research Institute is backing the efforts to create more dental therapists. B, the dental therapist model was supposed to solve the access to care issues in rural areas, but it hasn't. C, in general, dentists like Dr. Robert Rhoda and myself, Dr. Kvitko, feel that the dental therapist model is a failed experiment which should be scrapped. Or D, all of the above. All right? The winner is going to receive free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call, 614-459-9769. That's 614-459-9769. So go ahead and call now.
You won't believe it though. I wanna hear your mind, and there's nothing else in the world tonight. She said people don't take the time. Hey, people don't take the time.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko, let's go! Hi, I'm Johanna, and I've been a dental patient at Dr. Kvitko and Associates for over 10 years. I would really recommend Dr. Kvitko for your family's dental care. They're friendly. They're always there to help me. I feel like family when I walk in the door. It's clean, it's comfortable. Even if I have to bring my kids, they have a great playroom for them. I know when I'm with Dr. Kvitko, they are taking that extra time to make sure that I'm going to be the healthiest I can be. They've been great. I love them.
Call Dr. Kvitko and Associates today, 614-262-9588.
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. All right, we're back. We're doing Dr. Kvitko's question of the day. During the break, my producer took the phone calls. Tell me who is the winner of Dr. Kvitko's question of the day, who had the correct answer, which is D, all of the above.
The winner of the free flowers is Melissa from Clintonville.
Congratulations to our winner. Enjoy those flowers from DeSantis. And thank you for calling. And those of you that didn't win, please call next week. Okay, if you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile. It's episode number 537. Thank you so much for joining me today. We were talking about the dental therapist model. It is a model that, in an effort to solve the access to care issues in rural areas in America, it came up with another level of a provider. It's called a dental therapist. They call it a mid-level provider. The idea being is that you could train somebody right out of high school to do fillings, do x-rays, extract teeth, clean teeth, do educational services, and do it without a dentist present, although they would have to be associated with the dentist. Not only would that dentist not have to be in the room or in the building, but could be 100 miles away. So if you've been listening, you know that I don't think that's a very good idea, and we have now 7 years of data that has occurred in Minnesota because Minnesota instituted this back in 2009, which would mean more than 7 years of data now that I think about it. Let me check that. Okay, I think it's the fact that the law to create dental therapists in Minnesota was passed in 2009, but then it took a year or two to get it up and running. So that's why we have 7 years of data. But basically the data shows that it doesn't work. The original plan was to bring care to people that couldn't access it before and to keep the costs down, and it didn't do either of those. And yet, there are agencies like the Pew Research Institute and I believe the Kellogg Foundation are still pushing this as viable. So I think the reason might be that there are a lot of people that are unable to receive care. The rural areas are brought up a lot, where access to dentists is low, and many people do not address dental health issues until it's too late. These people often end up in emergency rooms instead of at the dental office. The Pew Center estimates that more than 830,000 visits to emergency rooms were for preventable dental conditions. But here's a fact. 3 times as many people nationwide are without dental insurance as are without health insurance. This is according to Delta Dental. Medicare does not pay for dental services except in rare cases, and Medicaid leaves dental insurance up to the states. Now, here in Ohio, we've heard a lot of talk about how Ohio, Governor Kasich, took the federal government's offer of expanding Medicaid by accepting the federal money. Remember that? A lot of people were very happy about that because it would allow more low-income families to receive benefits that they weren't currently receiving, because I guess the state wasn't providing enough money for them to receive care. And so my question has always been, why? Why can't the state find the funds to take care of people and do it in a way that is in a normal setting, in a normal dental office, with normal dental assistants and dental hygienists and the dentist and the receptionist and the dental lab technician, everything that we've come to know as what makes a dental office tick, rather than having to look for some new dental office personnel person, that's going to do some of this and some of that and doesn't have the training that a dentist does. And to me, it's just unnecessary. In fact, the experience that Minnesota has had kind of proves that. Now, one of the reasons that people were upset with Governor Kasich accepting that Medicaid expansion was the federal money is not guaranteed over, I believe it might be after 2 or 3 years. And so then what happens? Because then you have all of these people that have grown accustomed to having the care, the access to care, and then you take it away. So it just feels like there should be a way for our legislature, for our governor, whomever, to find a way to fund good dental care for children, for low-income people, out of the state budget, rather than having to rely on the federal government, which will then be pulling the plug at some point, Okay, it looks like we're up against a break, so we're going to do that. You're listening to The Reasons We Smile with Dr. Kvitko, episode number 537. When we come back, we're going to talk about what is covered by Medicare, what is covered by Medicaid, and if it's not covered, maybe we can help figure out why. All right, we'll be right back.
You can't take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, of the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
All right, we're back. If you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile, episode number 537. Today we've been talking about the dental therapist model. A dental therapist is what they call a mid-level provider that some people are proposing as a way to increase access to care to low-income people, especially in rural areas where there may not be enough dentists. I'm on record as saying I think it's a terrible idea, and in fact, in Minnesota, they have tried it for 7 years, and it didn't increase access to care, didn't lower the cost, and in fact, they have a very low rate of low-income children actually visiting a dental office. Only 41% were seen at a dental office in that time frame, which is 8% lower than the national average of 49%. And so I also wanted to talk a little bit about why doesn't Medicare, or let's start first with what does Medicare cover when it comes to dental. So I went to Medicare.gov, and I found that it says, Medicare doesn't cover most dental care, dental procedures, or supplies like cleanings, fillings, tooth extractions, dentures, dental plates, or other dental services. Medicare Part A, which is hospital insurance, will pay for certain dental services that you get when you're in a hospital. Part A can pay for it if you need to have emergency or complicated dental procedures, even though the dental care isn't covered. And so I'm trying to understand, I've always wondered this, why doesn't Medicare cover dental care? When people retire, they find out that they don't have any dental insurance. Even if they had it when they were working, now they're required to sign up for Social Security and sign up for Medicare, and that's when they discover, oh, I'll be darned, I don't have dental insurance anymore. It seems to me so backwards because oftentimes that's when people are going to need it the most. So then I went to Medicaid.gov and I was trying to figure out if Medicaid covers dentistry. So on Medicaid.gov it reads, dental health is an important part of people's overall health. States are required to provide dental benefits to children covered by Medicaid and the Children's Health Insurance Program, also known as CHIP. But states choose whether to provide dental benefits for adults on their own. But let's talk about dental benefits for children in Medicaid. Medicaid covers dental services for all children enrollees as part of a comprehensive set of benefits referred to as the Early and Periodic Screening, Diagnostic, and Treatment Benefit, EPSDT. Though oral screening may be part of a physical exam, it does not substitute for a dental examination performed by a dentist. A referral to a dentist is required for every child in accordance with the periodic schedule set by a state. So to me, this is kind of ironic because one federal agency that administers Medicare is saying, hey, dentistry is not important. You don't need that. We're not going to provide that. And then another one, the one that administers Medicaid, is saying how important it is. So what are we going to do? We're going to get everybody's teeth healthy when they're young so we can just ignore them when they become adults? I mean, that's what it feels like. That's what it seems like. And I just don't get it. I just don't get it. Wouldn't it be nice if we could come up with a way to provide great dental care for everyone? For children from low-income families, children from medium-income families, children from well-to-do families, and the same for adults. I mean, adults deserve good care, great care. Adults deserve to be comfortable, to not have toothaches and to not have broken teeth and broken fillings and discolored teeth and, that blacked out area. I mean, it's very sad, but I think we've established on this show before that you can tell the socioeconomic level of a person by looking at their teeth. You can just spot it walking down the road. You don't even have to be near them. You can see them from across the street, and it's very, very sad. I don't know the answer, but I'm hoping some legislators are listening. I'm hoping some people who have the power to make this change are listening, because as far as I'm concerned, it's way overdue. Way overdue. We can do better, and we should do better. And I guess we'll just leave it at that and hope that the powers that be can somehow muster up the courage to solve this issue. All right, okay. I'm sorry I got on my soapbox there a little bit, but I believe it's necessary. I really do. We need to speak out. All right, that's all the time I have. Let me just remind you, if you are a dentist with 3 or more years of experience, please give me a call or email me, 614-262-9588 or bkvitko@aol.com. Don't forget to follow me on Twitter at Dr. Kvitko and visit my office Facebook page. It's Dr. Kvitko and Associates, and please like us if you will. Remember, all past episodes, complete with video, are available at thereasonswesmile.com. Be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262 614-262-9588. That's 614-262-9588. Or send an email to speaking@thereasonswesmile.com.